My name is Marci Serota. I'm so glad to see you all here today for my talk on hypothalamic obesity and nutrition. So, for those of you who don't know me, I see a couple familiar faces out there. I'm glad to see you here. I am a registered dietitian nutritionist, and I also have a 14-year-old who was diagnosed with a brain tumor when he was 3 years old, and he is now 14 years old. So, I'm excited to share with you how I am able to keep him healthy despite his diagnosis of HO, and how I've also helped some of my other clients stay healthy with this condition. So here are my references, just in case anybody wants to see them. So our objectives today, we're going to be talking about what diets are most likely to work in patients with HO and why. How can we minimize insulin secretion? What is the difference between nature-made food and man-made food, and which is better for individuals with HO? Why sugar should be restricted in individuals with HO, what other foods should be avoided, and hopefully we'll be able to get to which medications may cause weight gain irrespective of HO. So let's dive right in. I always like to start any nutrition talk with trying to take the emphasis off of weight. Okay, I think weight, focusing on pounds or kilograms, how many you've gained, how many you've lost, is very, very stressful. And so I would encourage everybody to just realize the fact that weight loss is a means to an end. Okay, the purpose of a diet or a different way of eating is not to lose weight, it's to improve your health. But you have to lose the weight in order to improve your health. So I would just encourage you, especially those of you out there who are parents that have children with this condition, rather than focusing on weighing your child and, how many pounds up or down or kilograms, I would encourage you to focus on things like maybe blood pressure goals, hemoglobin A1C goals, if that applies, triglycerides, maybe keeping them under, a certain number, ALT, which is a marker for fatty liver disease. And then also focusing on desired behaviors such as exercising a minimum of 3 times a week, not eating between 9 p.m. and 7 a.m., not stealing or sneaking food, not eating out of the trash. And of course, if you are a parent or even a spouse, giving your family member with HO positive reinforcement for meeting those goals. So keep a chart, log in your exercise, log in how many times you did eat between 9 and 7, and then give them something that they've been wanting, a little something for meeting those goals. It's very, very motivating. So does hypothalamic obesity respond to diet and exercise? That is the million-dollar question. And I believe it is possible. I think you have to have realistic expectations and understand that there is a spectrum of hypothalamic obesity. Whether or not you lose 30 pounds or 5 pounds following the same type of diet is going to depend a lot on the size and location of the tumor, the amount of hypothalamic damage that was done by the tumor or the treatment, and the experience of the surgeon or radiation oncologist that you saw for your treatment. Success is also going to depend largely on family support. It's hard to do this alone. You cannot expect a child or a spouse to be the only person in the house that is not allowed to eat certain foods or has to eat a certain way. So I highly encourage you to make this a family thing as much as possible. Success is also going to depend on hormone replacement being optimal. Okay. So what I hear a lot in our discussion groups is that local endocrinologists often do not have experience with this condition. And it's absolutely vital that you find an endocrinologist that has had success treating this condition. And today with telemedicine, it is so easy. I mean, you can make an appointment with CHOP for telemedicine, see a neuroendocrinologist, get them to write down the recommendations for your local endocrinologist. And most likely they're willing to follow recommendations from a neuro-oncologist or somebody who maybe just has had more experience than they have in this condition. So the difference that a moderately low carbohydrate diet, when I say moderately low, I mean about 90 to 120 grams per day, can have in a patient with moderate HO. So on the left, you see a patient with HO. He has a very high BMI, about 38. He had fatty liver disease, high blood pressure. His lipid levels were very, very in an unhealthy range. And then you see the same child a couple years later on the right, after being on this type of eating plan where his BMI went from 38 down to 25, complete reversal of fatty liver disease, normalization of blood pressure, and lipid levels all really looking good now. So, what diet is most likely to be effective in an individual with HO? I'm sure you can guess by now. I've tried to divide this into three different groups because what I see in my practice is that there's kind of three groups of people with HO out there. There's the people who have sort of mild HO. Um, they may have severe hyperphagia, but when I say mild, what I mean is they're going to respond to this diet. So this diet of about 100 to 120 grams of carb a day, which is a controlled carbohydrate diet. Then you're going to see children and adults with moderate HO. They're not going to see success on that diet. So then you want to take them down to a low carbohydrate diet, which is between 50 to 100 grams a day of carb. And then there are those who are not going to respond to that, and those are going to have more severe HO. And those are going to need to be on a either very low carbohydrate or ketogenic diet, which is going to be less than 30 to 50 grams of carbohydrate a day. So the question is why? Why does a low carbohydrate diet work in this patient population? So that brings us to the carbohydrate insulin model of obesity. So this is a hypothesis that has been brought back. It was actually proposed a couple decades ago and largely ignored. But Dr. David Ludwig, who is a pediatric endocrinologist at Children's Hospital Boston, has written several papers on this model of obesity. And he does not, as far as I know, I don't think he sees HO patients, but this is the theory that I used. It was very successful in my son and what I wrote about in my book. So what he proposes, Dr. Ludwig, is that not all calories are created equal and that quality matters more than quantity. So, we used to say a calorie is a calorie. Well, 100 calories of Skittles is going to create a very different hormonal environment in your body than 100 calories worth of, carrots and guacamole. So those are each going to trigger different hormones, which are going to have an effect on our hunger and our weight. So quality matters more than quantity. A high carbohydrate, low fat diet, according to Dr. Ludwig, causes high insulin levels and low glucagon levels that last up to 2 to 6 hours after eating a meal. Okay, so what happens when you have these high circulating insulin levels and low glucagon levels is that your body is told to store fat and it's told not to break down this fat. So even if you get hungry later, even if your blood sugar drops, your body is not going to break down that fat. It's not going to break down glycogen that's stored in your liver and in your muscles to raise your blood sugar. It's actually just going to make you feel very hungry so that you eat more. So that's the result of a high carbohydrate, low fat diet. So this high insulin glucagon ratio several hours after eating results in low blood sugar, perceived starvation, increased hunger, and actually decreased metabolism. And he's done several studies to this effect, which I'll get to in a minute. And he's also found that high insulin secretors, which most people with HO are most likely to benefit from a low carbohydrate diet. So I'm not going to spend a lot of time on this slide, but this was a really good study that was done by one of Dr. Ludwig's colleagues, the effects of a low carbohydrate diet on energy expenditure during weight loss maintenance. So this was a randomized multi-center trial of 164 adults who were considered obese. It was done over a period of 20 weeks. They were not patients with hypothalamic obesity. We don't have very many of those studies, so we have to look at others. And his main outcome was really looking at total energy expenditure. So how many calories your body is burning a day. So what he saw, he divided the patients into three groups: a low, moderate, and high carbohydrate diet. And then he compared their energy expenditure, their metabolism during this weight maintenance phase after they had lost a bunch of weight. And what he found was that the people in the low carbohydrate group, their total energy expenditure, their metabolism was much higher, up to 91 calories per day greater in the moderate group compared to the high carb group. And it was 200 calories per day greater, those assigned in the high carb group I'm sorry, the low carb group as opposed to the high carb group. And then he divided the participants into tertiles according to insulin secretion. So you've got your low insulin secretors, your middle, and your high insulin secretors. And he found that the high insulin secretors, which are most people listening to this talk today that have HO, their metabolism increased the most on a low carbohydrate diet, up to, I think, between 300 and 500 calories per day more. So I thought that was really, really fascinating. So how does this apply to individuals with HO? As I've said, most of us have high chronic insulin levels due to hypothalamic damage. Many patients with what we call simple or regular obesity develop insulin resistance, which means their insulin doesn't work very well because there's fat blocking insulin receptors. So then they're just secreting more insulin on top of that. So, and we know that too much insulin causes weight gain and makes weight loss very difficult because insulin is an anabolic hormone and it's building, it's storing. It is not breaking down and burning calories. Therefore, it makes sense to, to theorize that minimizing insulin secretion by limiting carbohydrates may facilitate weight loss in individuals with HO. And this is what I have seen. The proof is in the pudding. On the left, you have a child with HO, high carbohydrate, low fat diet, no exercise. You see the central adiposity, all the weight carried around the middle. And on the right, you see the same child 1 year later on a moderately low carbohydrate, high fat diet with exercise. Look at the difference. So now that we understand that our main goal is to decrease or sort of minimize our insulin secretion, we need to understand, well, okay, if you're looking at fat, protein, and carbohydrate, what is their effect on insulin secretion? Well, interestingly enough, dietary fat stimulates almost no insulin secretion. So, dietary fat, which has been demonized for decades, is actually the best food to be eating if you have HO because it's going to have no effect on insulin levels. Protein is the second best food to be eating. It does stimulate some insulin secretion, but not nearly as much as carb. And then we've got carbohydrate, and sugar is a carbohydrate, so I've included it here, is going to stimulate the most insulin secretion. And, some carbohydrates stimulate more than others, depending on their glycemic index, which I'm not going to get into today because that's a talk in and of itself. But suffice it to say that if you stick with nature-made carbs, you don't have to worry about glycemic index. So we'll get to that soon. So again, minimizing insulin secretion is the goal. We can do this by limiting our carbohydrate intake to anywhere between 20 to 120 grams a day. I realize that's a very broad range. And, it just depends, again, on your degree of hypothalamic damage. So that's roughly in the middle, about a fourth of a cup to half a cup of carbohydrate about 5 to 6 times a day for the higher end of that range. Avoiding man-made processed carbs, limiting or eliminating sugar, eating 90% nature-made food, only 10% maybe, minimally processed or even sort of processed foods, and then replace many of the processed man-made foods with dietary fats, protein, and non-starchy vegetables. And then again, exercising a minimum of 3 times a week, daily is better, will improve insulin sensitivity, which can decrease insulin production. So yes, I am going to define dietary fat. It's coming up in a slide very soon. That's a great question. So first I'm going to talk about what carbs there are. Healthy carbs for HO, I've put a list here so that you can kind of take a screenshot and keep this with you. Healthy carbs are going to be non-starchy vegetables, fruit, starchy vegetables, which are going to be your squishy vegetables like your potatoes, your winter squash, your peas, your corn. Back up to non-starchy vegetables. Those are going to be your crunchy vegetables. So your broccoli, your leafy greens, your cauliflower, your Brussels sprouts, your eggplant, your tomatoes, your celery. Unprocessed grains such as brown, wild, black rice, quinoa, millet, and bulgur. We've got whole milk yogurt, unsweetened, is a really good carbohydrate for patients with HO. It's very high in fat. And very low in carbohydrate. Well, it does have about 12 grams of carbohydrate per a 4-ounce serving, but you're allowed to have a 4-ounce serving. Legumes and hummus, and then crackers that do not contain flour. And some brands that we like are going to be Crackers, Mary's Gone Crackers, and Woven Wheats. Okay. Again, just a list of non-starchy vegetables here. They're so good for patients with HO. They're very low in carbohydrate. You can eat a lot of them. They're high in fiber. They're very filling. They're high in phytonutrients, which can help decrease, your chance of developing other chronic diseases. They're high in electrolytes, which can help lower blood pressure. You do want to limit them, not necessarily like how many you eat in a day, but just maybe how many you eat at one time to avoid gastric upset. So, if you're a small child, you may not want to be eating more than a half a cup at any one time. And if you're an adult, you can eat probably up to 3 cups at a time. And then I have a list of examples of our crunchy non-starchy vegetables, which you want to be eating with every meal and snack if possible. Animal protein examples are, your fish, your chicken, your beef. Animal protein does not contain any carbohydrate at all. Again, it stimulates some insulin secretion, but not as much as carb and sugar. And usually they contain dietary fat, which helps you feel full for longer periods of time. And now coming on to my fat slide. So when I talk about what is dietary fat, I mean, there's so many ways you can get dietary fat in. Some examples are going to be avocado, nuts, seeds, oil, butter, ghee, cream cheese, mayonnaise, fat that you find in meats, like I said, in animal proteins, bacon. Those are all examples of dietary fat, and those are great things to be eating because fat is satisfying. Fat delays gastric emptying, leading to satiety. So that means when you eat fat, it actually makes food stay in your stomach longer. So you will stay full even with hyperphagia for longer periods of time if you're eating a high fat diet, because the food, rather than emptying out of your stomach and going into your small intestines, will stay in your stomach longer. Please don't worry about counting fat grams. Don't worry about cholesterol. To borrow a quote from Dr. David Ludwig, saturated fat is not public enemy number one, okay? Public enemy number one is sugar and processed man-made carbohydrates. So focus on limiting carbs and sugar. And again, replace the processed man-made carbs with fat. So what is nature-made food? My definition is food that Mother Nature or God, whatever resonates with you, provides for us that humans have not changed. So, for example, fruits, vegetables, animal meat, nuts, legumes. Nature-made foods have a low glycemic index, which means that it's not going to stimulate as much insulin. Minimally processed food is another type of a category of food that also is okay to eat. And I define it as food that humans can make in their own kitchens. Food with very few ingredients. And examples would be cheese, whole milk, and sausage. Now, I know that nobody in this group is making sausage or whole milk yogurt in their kitchens, but in the 1800s, people did make these foods in their own kitchens. So theoretically, it's possible. So you have to think about it that way. So nature-made food, high in fiber and fat, which slows digestion and minimizes insulin secretion, more likely to make you feel full, and you're less likely to
佢
overeat
嗰啲
because it
呢
has a
個
low sugar
嗰啲
content.
呢啲 tea tree，因為
Examples of nature-made food are going to be berries, fruit, non-starchy vegetables. I think we already went over these foods, but I'll say them again. Eggs, cheese, avocado, olives, beef, poultry, fish, legumes, and starchy vegetables. I wanted to show you some pictures like, okay, now we've named these foods, but what are we actually eating? Well, these are things that we actually eat in my house. On the left, I've got a snack of celery sticks with unsweetened almond butter, pomegranate seeds, dark chocolate chips, which are very low in sugar, and a clementine. In the middle picture, we've got a hamburger patty with carrots and ranch dressing. And then on the right, we've got just a simple tomato cucumber salad. So this is a great example of a nature-made meal. On the left, we've got beef, we've got avocado, we've got sweet potatoes, quinoa, hemp hearts, we've got snow peas, mushrooms, and onions. And on the right, this is a fabulous snack for somebody with HO. It's an avocado BLT. So it's just half of an avocado with bacon, lettuce, and tomato in it and some salad dressing. More examples, if you have a picky child, I would recommend making snacks and lunches more fun by putting things on kebabs. Children tend to like things on kebabs. And if you are mixing up, putting lots of colors, bright colors, and mixing up colors, it's a lot more palatable, and looks more fun. On the right here, I've got mozzarella cheese balls with fruit. And then on the far right, I've got sushi rolls with rice flour. I'm sorry, rice paper rather than rice. This is more of a foodie type of a nature made food example. This is actually something I made for myself because I love this type of food, but I've got on the right, the left-hand side, I've got Gouda goat cheese, olives, sunflower seeds, fruit, and I've got venison sausage, I think with cheese and jalapenos. It was delicious. And on the right, we've got cashews, olives, fancy cheese, and blueberries. Now, notice when you look at these plates, the majority of the plate is not filled with carb. The only carb on these plates, is mostly coming from the fruit. And then the other foods on the plate are mostly protein and fat. There's a little bit of carb that comes from the nuts. This was an interesting picture I wanted to share. A cousin of mine was living in Israel, and he posted this picture of this, how he was going to miss a typical Israeli breakfast. And I thought, this is great. I'm going to put this in my slideshow and I'm going to compare it to a typical American breakfast. So on the left, you've got an omelet, cottage cheese, non-starchy vegetables, and olives. Fabulous breakfast for somebody with HO. And on the right, you've got your high carb breakfast. Half the plate is overflowing with carbohydrate. It's just way too much. I don't really have a problem with hash browns. I think, you can consider that a nature made carb, but the pancakes need to go, and the rest of it is just fine. So staples of the HO household, take a screenshot of this. These are foods that I keep in my house at all times. Animal protein, nuts, nut butter, seeds, non-starchy vegetables, fruit, popcorn, avocado, unsweetened yogurt, and lower carb grain-free granola. And then I've made another picture you can take a screenshot of picky eater HO staples. So, if you have a child that's very picky or even an adult, you can kind of start getting a little bit more into the paleo style bread, tortillas, wraps, and waffles. When I say paleo style, what they usually do is they will, rather than using wheat or rice flour, they will use a lower carbohydrate flour, such as almond flour or coconut flour, to make some of these foods. Crackers made with almond flour, nuts and seeds, fruit, rather than maybe a sugar-free yogurt. Maybe you give them a less sugar yogurt that does not contain artificial sweetener, and then grain-free lower carb granola. So now that we know what nature-made food is, what is man-made food? Food that can only be made in a factory, that you could not make in your own kitchen. Food with flour or some other version of sugar listed in the first 5 ingredients. Food with more than 5 ingredients, and some people just will call it processed food. So man-made processed food is going to cause insulin spikes. It's going to cause your blood sugar to plummet and cause you to feel hungry. Chemists get paid a lot of money, food chemists, to enhance taste of man-made foods using sugar, salt, fillers, artificial colors, and flavors. It makes it very difficult to stick to appropriate portion sizes. And in my experience, keeping man-made food in the house and serving man-made food, processed food, greatly exacerbates hyperphagia in patients with hypothalamic obesity. This is just real quick, a study that was done on 20 inpatients. I like that it was done on inpatients because you can control better what they're eating. There were 2 groups. One was given an ultra processed diet, and the other was given an unprocessed diet. And 14 days later, they tallied everything and found that the patients that were given the ultra processed diet were eating on average 500 calories per day more than the patients on the unprocessed diet, and their BMI changes matched that. So other examples of uber processed man-made carb that we want to avoid: bread, pretzels, chips, veggie straws, protein and energy bars, food with too many ingredients, factory made foods, sweetened beverages, and anything with flour or sugar in the first 5 ingredients. I don't care how healthy it says it is, it's best to avoid it. So, what's the problem with refined flour? Why is it good to stay away from foods that are made with refined flour? I wanted to kind of just lay it out for you. So, on the left, this is what wheat looks like the way that nature made it. Okay. And on the far right, you see a diagram of a wheat kernel. So, a wheat kernel is made of 3 parts. It's made of the bran, the outer layer, which is tough and fibrous. And it takes a lot of time for the enzymes in your body to break that down to get to that inner layer, the purple, which is the carbohydrate called the endosperm. And then you have the germ, which is the fat and some of the fat soluble vitamins. Well, what they do to make refined flour, they remove the bran, so they're taking out the fiber. They remove the germ, so they're taking out the fat, which helps, make you feel full. And all you're left with is this inner layer of carbohydrate, a little bit of protein, and they grind it down into a fine substance. In the middle, you see white refined flour. So we definitely want to avoid that because it causes insulin levels to be much higher. Sugar. So, what we know about sugar is that sugar causes the dopamine levels in your brain to go up. So, dopamine is a neurotransmitter, it's the feel good neurotransmitter. So, it's also the same neurotransmitter that when you take drugs or such as amphetamines, it makes those dopamine levels go up and it gives you that feel good feeling. And you're like, oh, this feels great. I want more of that feeling. So then you're more likely to indulge in the amphetamine or the sugar. And sugar can be addictive and it is purposely added to most man made processed foods. In my experience, there is no question it makes hyperphagia worse in individuals with HO. And when you take it out of your diet and you take it out of your household, you may very well see a significant decrease in the intensity of the hyperphagia. And then you want to avoid any food that has sugar listed in the first 5 ingredients. So, this is just a slide demonstrating what I was just saying about dopamine levels going up in the brain in response to eating both highly palatable food and amphetamines. And you see sort of that same, increase in basal dopamine levels. Now, of course, with food, it's the dopamine levels don't go anywhere near as high as they would with amphetamines, but it's still the same type of thing. And I saw this wonderful presentation by Dr. Nora Volkow at the National Institute of Drug Abuse. And she was explaining that, it's really interesting that the brain, the system that this dopamine system is, well, the drugs hijack a reward system that was created not only so that we can do not so that we can do drugs, but to ensure that we engage in behaviors necessary for survival. So in other words, if you're hungry and you're tired, well, what's your motivation to go chase a saber-toothed tiger or to go hunting for nuts and berries? Well, the motivation is that rise in dopamine level that you get in your brain after you eat the nuts and berries. So drugs are really just kind of using that system that was designed by nature to reinforce us to eat. So sugar goes by many different names. I wanted to give you a list of different names. It's not going to necessarily say on the label that it's sugar. It's going to say dehydrated cane juice or, turbinado or malt syrup. Here's an example. So I bought this package of popcorn, peanut butter popcorn. I was in a rush and I didn't look at the ingredients. Popcorn's a great nature made food. And then later, much to my dismay, I looked at the ingredients, and in the third ingredient, which is seasoning, there are not one but 2 forms of sugar, maltodextrin and dextrose. Why do you need to put sugar in popcorn? The answer is to get you to eat more and to get you to keep going to Starbucks to buy that popcorn because it tastes better. And if you'll notice, if you look at the top of the right-hand side of the screen where it says includes 0 grams of added sugars. Well, what that means is they've put sugar in there, but not enough to legally have to list it, in the added sugars section. But there is enough there for it to increase your hyperphagia. So that's why I say don't eat sugar in the first 5 ingredients. Somebody just asked, yes, if it's in the 6th ingredient, it's fine. Because ingredients are listed by how much. So the first ingredient is what is present, what's the food is mostly made of. And then the second is the second most abundant ingredient, and so on. So hidden sugars are everywhere. I mean, you need to check your salad dressing labels, your tomato sauce, your deli meats, your frozen food, your ketchup, your nut butters, bread, processed food, yogurt, and your fat-free and low-fat foods, which you should avoid. So then the question is, well, should we be eating any sugar? And in my experience, there's two categories of people. There are people that can eat sugar once or twice a week, a small portion size, maybe a child-sized portion of ice cream, a small slice of cake. They do fine. And in fact, it's, helpful to use it as positive reinforcement. So if a child is having trouble struggling with, sneaking food or stealing food from somewhere, well, if they don't engage in these behaviors, they get their treat at the end of the week, and it can be very motivating for them. Then there's a second group of people that any sugar at all really makes their hyperphagia so much worse, and it actually drives them to go, eating out of the trash and stealing food. So if you just have to experiment and find out which category you're in. And if you fall into the latter category, I would avoid it as much as possible and altogether. Artificial sweeteners is a controversial topic. I put them in the man-made food category. I don't think that there's something that individuals with HO should be eating. The only exception to that is if you have a child with diabetes insipidus, that does not have a thirst mechanism, and you need to get them to drink fluid. And the only way you can get them to drink fluid is giving them something artificially sweetened, then absolutely that is more important. Go ahead. But for the rest of us, I think it just reinforces our habits of consuming sweet things. It gets your taste buds used to incredibly intensely sweet things, and then regular food just tastes very bland in comparison. And you'll find if you stop eating a bunch of artificial sweetener that man-made food will start tasting better. And there's some evidence that artificial sweetener can actually impair glucose tolerance. So it can actually, cause your blood sugar to be higher and cause you to maybe become pre-diabetic or even diabetic. Um, Although, again, that's not been proven. And, it may increase appetite. So I wanted to give you another list to take a picture of. Individuals with HO should avoid the following foods as much as possible. This is my list of the worst foods for people with HO: fruit juice, milk, soda, too much fruit. You do not want to be eating more than about, I would say at the most 12 ounces of fruit per day, some people less, because it does make your triglycerides go high and it does contribute to fatty liver disease. Dry cereal, processed food, sugar and artificial sweeteners, food marketed to be low fat or fat free. That's always going to have a very high carb, high sugar content because they got to make up that fat they took out with something. Bread and refined wheat and flour pasta. So then what should we be drinking? That's a question I get asked very often. Water, water, water. If water doesn't taste good, you can put cucumbers in it, you can put fruit in it, let it soak up the flavor. And if you can afford it, I would highly suggest investing in a reverse osmosis water filtration system. It goes under your kitchen sink. You can rent them often, you can buy them, and it makes the water taste so much better because it takes all the chlorine out of the water and a lot of the other impurities that other types of filters don't get. It's the strongest filter on the market as far as I know. Herbal tea is also great. I mean, hot or cold. I mean, there's all different flavors of herbal teas. I mean, I think there's, strawberry herbal teas that you can get herbal tea with ginger and turmeric with, any flavor you like, mint, spearmint, and you can even keep that cold in the fridge if you like that. And of course, it's fine to have, for adults, coffee and regular tea. And then there are some beverages that contain these naturally flavored beverages or sweeteners. I don't think it's great, but again, if you need it to meet fluid needs, or if it's something you want to do maybe once a day, there's no evidence to say that there's anything wrong with it yet. So we're coming to the end of our presentation here. Since so many individuals with HO have so many different medical issues, I felt this was a really important topic to address. So, I took my son to, he has a seizure disorder, and I took him to the neurologist, and he was going over a list of medications that might be helpful. And he mentioned a medication called Depakote. Well, I know from my clinical experience that Depakote can cause a tremendous weight gain. And so I very quickly said, okay, Depakote's not on, we're not going to have that on the table. Let's try everything else first before we even think about using that medication. And then he was like, okay, that's fine. But you just have to understand, when you go to specialists, they are not necessarily thinking about your HO as their main concern. It may not even be on their radar. They're thinking about how to fix the problem that you came to them to solve. So if you take away anything from this talk, I want you to remember, when you go see a specialist or any doctor, and they prescribe a medication, you ask them, is this a weight neutral medication? And if the answer is no, that needs to go to the bottom of your list. I've highlighted the biggest offenders in red. We're out of time, so you can look at these later. I tried to list them. And I wanted to end with a quote by Dr. Mark Hyman, who's a functional integrative medicine doctor at the Cleveland Clinic. And, they say know your audience. He was speaking to a church group when he said this quote. And what the quote was is, if God made it, eat it. If man made it, leave it. And so if that does not resonate with you, I realize I'm not speaking to a church group. You can insert the word nature. If nature made it, eat it. If man made it, leave it. And if you have any more questions, I put my email on the first slide. You can find me on my website, and you can purchase my book, Hungry for Solutions, which is a very detailed book about my story and how to battle hypothalamic obesity via diet, which you can buy on my website. Thank you so much. Okay, I'm going to get to the questions now.